Local health officials say they're concerned after the United States withdrew its membership from the World Health Organization. Jaden Urban joins us live here in the studio after learning more. Jaden, how soon could these impacts be felt?
Northern Nevada Public Health says most of it will be in the long term rather than the short term. Now, as a local agency, it did not work directly with WHO, but it could feel the trickle down effects.
As a local public health agency, we don't interact with the WHO on a day-to-day basis, but we're part of this interconnected public health network.
Last week, the United States officially removed itself from the World Health Organization. It comes after President Trump signed an executive order initiating the process within his first few weeks in office. The White House said one of the reasons why was due to the organization's alleged failure for its handling of the COVID-19 pandemic. Local health experts fear that if we find ourselves at the hands of something similar, we may face more challenges.
If the next pandemic do happen, I fully expect for us to see possibly a delay in information, but when there is a pandemic, that small delay could mean a lot in our response.
The White House also criticized WHO's lack of reforms coming out of COVID. Northern Nevada Public Health says there will be gaps in global surveillance and as well as tracking influenza spread.
So if we're not at the table when we're talking about influenza surveillance, looking at how the virus is mutating, and if there's a delay in that, our response is going to be delayed.
The country also relies on data from the Southern Hemisphere to make its vaccines every year. There are also concerns with losing funding for HIV medications, which could see case increases. Since the U.S. is no longer at the table, goals and priorities are expected to shift, and it will also be harder to track trends in diseases.
I would fully expect to see an increase in emerging and re-emerging diseases in the upcoming years, and there's going to be an increased burden on our response as a public health agency and control.
California is the only state to rejoin the WHO Coordinated International Network, and we reached out to Governor Joe Lombardo's office for a comment and to see if Nevada would consider following suit, and all we got was a quote, "No comment here." Covering Health Watch, Jaden Urban, 2 News Nevada.